Module 7. Appropriate and quality service delivery. Health facilities do not have appropriate equipment to be able to provide adequate services to minors, ex-minors, along with their spouses, families, and communities. Health workers do not have adequate capacities to provide quality services to minors, ex-minors, along with their spouses, families, and communities. There are weak linkages between health facilities, health service providers, and the communities they serve, which limits potential for community-based TB care. Chipata Health Center is located within mining communities in Kitwe, Zambia. The health facility was built in 1982 and predominantly serves minors, ex-minors, their spouses and families, as well as communities surrounding the mines. TB is highly prevalent in the area, and 1 in 2 patients assisted in the facility has TB-related illnesses. Chileshi is the nurse in charge and has worked at the health facility for the past 17 years. Since she joined the hospital, they have always had inadequate equipment for TB screening and have always had to refer clients to the provincial hospital. Chileshi highlighted that the prevalence of TB in the area should have been enough justification to improve equipment at the facility. She has discussed with senior Ministry of Health officials about the need to provide equipment to enhance provision of quality services. She has also tried to engage mining companies. Minors and ex-minors highlighted that the health facility was not useful, and in their view it is better to go straight to the provincial hospital since going to Chipata will not assist. They also highlighted that health workers at the provincial hospital provided more information about TB as well as treatment adherence. But at Chipata, no information is provided despite the area having high TB prevalence. It is important for mining companies and health departments to ensure the health facilities in the area with high TB prevalence have adequate equipment to ensure minors, ex-minors, their spouses, and their families receive quality services. Health workers need to be capacitated in order for them to be able to provide information about TB prevention, treatment adherence, and support needs. Minors, ex-minors, their spouses, and their families need to understand ways of engaging health service providers in order to ensure that they receive quality services. Chileshi highlighted that due to the absence of proper equipment, some patients die before they go to the provincial hospital. She outlines that the fact that the health facility is not well equipped has resulted in minors and ex-minors feeling that the health staff are not helpful. The fact that the health facility is also not equipped to provide services makes it difficult for health workers to conduct outreach to provide information, which is crucial for prevention as well as treatment adherence and support in relation to TB. The downward referral system is also not well developed, and patients from that community who are enrolled onto treatment by the provincial hospital cannot be supported properly in the community. Chileshi concludes by outlining that there is great potential for the facility to adequately support the community if there is appropriate investment in equipment, training for health workers, and social mobilization, as well as demand generation. Takeaway messages. Health facilities in the area with high TB prevalence need to be equipped to provide adequate quality support for minors, ex-minors, their spouses and families, as well as communities surrounding the mines. Health workers need to be capacitated in order for them to be able to provide quality services. Minors, ex-minors, their spouses and families, as well as communities surrounding the mines needs to cultivate positive relationships with health service providers in order to ensure they access quality services and receive support. Referral networks need to be strengthened to ensure that distance and geographical locations do not contribute towards compromised care and support for minors, ex-minors, their spouses and families, as well as communities surrounding the mines. So, what do you think about the module?